Good morning, everyone. My name is Sandra Hanmer, and I'm the chair of Grand River Hospital Board. Today, I have the great opportunity of welcoming everyone to our Freeport campus for an exciting ministry announcement. With us today, we have the Honorable Sylvia Jones, our Deputy Premier and Minister of Health, as well as MPP Mike Harris, went to the other side of me, MPP Dixon, Chair Redmond, and Mayor Barry Verbanovic. We are also honored to be in the company of our health system partners from St. Mary's General Hospital, and I'm happy to welcome President Mark Pham. We are all working together on an exciting joint master planning project to build a new hospital in Waterloo Region. Welcome to all our distinguished guests and members of the media. Our Freeport campus is Grand River Hospital's oldest building at 107 years old. Within these walls is so much of our region's history, healthcare history, from its beginning as a tuberculosis sanatorium to its evolution as a rehabilitation hospital to its formal integration with Grand River Hospital almost 30 years ago. Along with evolution goes innovation. Together with our programs at the KW campus and our regional hospital partners, our teams are working together to transform the way we deliver healthcare in our communities, whether it's as big as a partnership with local startups or as simple as changing the way a task is completed. The dedication and commitment of our team members and our healthcare professionals is always changing our care experience for the better and for the future. Grand River Hospital is focused on building a world-class health system that supports healthier lives. We are driven by inspired people and unwavering quality focus, strong partnerships, and innovative solutions. Together, we will realize our mission of delivering an exceptional healthcare experience for all with compassion. I'm very pleased now to welcome Minister Jones.
Thank you, Sandra, and good morning, everyone. It is wonderful to be at Grand River Hospital in Kitchener today. I would also like to acknowledge my colleagues, MPP Mike Harris and Jess Dixon, who've been champions for the Kitchener area at Queen's Park and strong supporters of building a more connected healthcare system in their communities. On behalf of Premier Ford and our entire government, I also want to express our deepest appreciation to all the incredible healthcare workers here at Grand River and across the Kitchener area. You know, we had an opportunity very briefly earlier this morning to walk through the rehab and to see the healthcare professionals working together as a team really speaks to the value and importance of what you're doing here, for your tremendous commitment to providing world-class care for patients and their family. Ontario is proud to be home of one of the most dedicated and highly trained work care forces in the world. Through our government's Your Health Plan, launched earlier this year, we are further growing our healthcare workforce by investing in education and training, making it easier for healthcare professionals from other provinces and countries to train and practice here in Ontario. We have worked with both the College of Nurses and the College of Physicians and Surgeons to break down barriers for internationally educated healthcare workers to begin working in Ontario faster. We've expanded the Learn and Stay grant program, a program that covers tuition and other educational costs to students in nursing, paramedic, and lab technologist programs in exchange for a period of service in an underserviced area after graduation. And we have launched the largest medical school expansion in over 15 years, building a new medical school in Brampton and adding new undergrad and residency positions at every single medical school in the province. Today, I am very pleased to announce that our government is doing even more to grow the healthcare workforce across Ontario, helping Ontarians access convenient care closer to home. Our government is launching 3 new programs to further break down barriers for international doctors to practice in Ontario, providing experienced nurses with leadership and mentorship opportunities, and launching a new $40 million Models of Care Innovation Fund. The new Practice Ready Ontario program for internationally educated physicians will allow those with previous medical experience abroad to undergo an assessment to determine if they are ready to practice in Ontario immediately without having to complete lengthy re-educational programs. This will add over 50 new physicians to our healthcare workforce by 2024. We are also launching the Clinical Scholar Program, which enables experienced frontline nurses to become dedicated mentors to newly graduated nurses, internationally educated nurses, and those wanting to upskill. This will also help retain experienced nurses by providing them with the opportunity to share their expertise and knowledge, and retain new nurses by providing them with the dedicated support they need to confidently transition into the nursing profession. We are also now accepting proposals for a new $40 million Models of Care Innovation Fund, which will allow healthcare organizations to bring forward innovative ideas that help maximize the capacity and expertise of healthcare workers to provide Ontarians with better, more connected access to care. In addition, our new As of Right rules, which come into effect today, will make Ontario the first in Canada to allow physicians, nurses, respiratory therapists, and medical lab technologists who are registered in other Canadian provinces and territories to start working immediately in Ontario without having to first register with one of the province's health regulatory colleges. This change will allow highly skilled healthcare workers who want to work in Ontario to the front line quicker. Our government will continue to take bold and innovative action to grow our healthcare workforce across the province, building on the record year we had with over 1,500 new nurses, 15,000 new nurses registered to work in Ontario and 30,000 students in nursing programs across Ontario to continue to strengthen our province and our public healthcare system, making it faster and easier for Ontarians to connect to the health services they need closer to home. I now want to welcome Kate Robertson-Kane, Vice President, Clinical Services and Chief Nursing Executive here at Grand River Hospital, to the podium. Thank you, and stay well.
Thank you, Minister Jones, for the exciting announcement. In my role as Chief Nursing Executive, I know firsthand the impact the last few years has had on our teams. The pandemic highlighted strains and stress points on our healthcare systems, including a significant shortage of skilled and specialized talent. It also highlighted the amount of talented and qualified professionals we have who have been trained internationally or out of province, but have been unable to easily navigate entry into practice in our healthcare system. Grand River Hospital, along with our regional hospital partners, have been lucky enough to benefit from the province's innovative initiatives that help to train our current and next generation of healthcare professionals. This includes the Clinical Extern Program, the Supervised Practice Experienced Partnership Program, and the Community Commitment Program for nurses, which has been instrumental in attracting nurses to join GRH. Quite often, students and learners who take their placements at our hospital come back to us to practice full-time once they've graduated. And these programs don't just benefit learners, they benefit our teams as well. Through these partnerships, our teams meet new people and learn new skills along the way. Not only is this a win for our teams, but the result is a better care experience for our patients. These two new programs announced today, geared to make it easier for international doctors to practice and to provide experienced nurses with leadership and mentorship opportunities, are sure to help us deliver convenient care to people in their own communities. I also want to take this opportunity to thank our incredible healthcare workers across our hospitals, our regions, and our province. Your dedication to delivering high-quality patient care inspires us as we work together to build the future of care in our communities and across our province. I'd now like to invite Minister Jones back up to the podium to say some final remarks. Thank you.
All right, we'll now begin to take questions from the media. If media present could kindly line up behind me at the microphone. As a friendly reminder, the format is one question, one follow-up. Please state your name and your outlet before your question. First question. Who's up?
Hi there. My name is Trishla. I'm from CBC. When is the new hospital? When can we expect it?
Oh, well, there's many pieces that are going into the planning stage of the new facility here to serve the people of Kitchener. And as I understand it, there is currently a community consultation that is going on in terms of siting. I don't know. Yep, there you go. So it's in process.
And what else is being done in the interim?
Well, I think, as we went through today, the partnerships that are happening already within the existing facilities. One of the departments that I was able to visit with MPP Dixon and Harris was actually a partnership that was helping out Cambridge Hospital while they're doing some extensive renovations. So there's a lot of integration that is already happening in this community, and that will continue. We need to make sure that even hospitals that are in process of being expanded or new builds, renovations, they have to continue to operate and serve the community. And I have to say, having had the opportunity to walk through and talk to some of the staff, there is a lot of innovation that is happening today in what, as was mentioned, is a 100-plus-year-old building.
All right, we'll move to our next question. Oh. If we don't, yeah, step right up. Go ahead.
Hello, Dan Lochner from CTV Kitchener. We have data reported this morning that the use of expensive agency nurses has quadrupled since the pandemic. How do you justify allowing so many taxpayer dollars to flow to private companies?
There is no doubt that we have had to utilize and use agency nurses. I will say that same article highlighted that, in fact, pre-COVID, the percentage of hours that were used has actually decreased. But we have always, as hospital partners, utilized agencies for healthcare personnel when there are increases in demand and the need for those services. It just speaks to the fact that when we have hospital partners who are able to react and respond to increased community needs, they have the ability to do that.
And why won't Ontario do what critics have been begging you to do, to impose caps on wages or use of agency nurses?
Well, as I said in my previous answer, we've actually seen a decrease in the number of hours used for agency nurses. Look, we want to make sure that every healthcare clinician, whether they are nurses, lab techs, doctors, have the opportunity to have full-time employment in the province of Ontario. And we want to make sure, so as an example, the retention pay that was offered during COVID for full-time workers was only available to individuals who worked full-time in full-time roles in hospital and settings where nurses were being needed. So we'll always want to make sure that people have the opportunity to have those full-time opportunities. That's why we've expanded the Learn and Stay program. That's why we have nurse preceptor programs that really get that opportunity for a more senior nurse with lots of experience being able to mentor and bring that young new nurse on board and online. All of those programs together really speak to our government's commitment to making sure that if you want to practice nursing in the province of Ontario, you will have a position and an opportunity to do so.
Next question.
Hi, Joanna Widener from the Waterloo Region Record. Wondering what's being done now to help with the current situation of hospitals having to close their emergency departments or reduce services on the weekends because they don't have enough staffing.
Yeah, it's, there was a comment made that one of the most challenging things that a hospital leadership must do is make a determination whether keeping an ED open, even for a shift, is safe for the workers and safe for the communities. So we have made sure that our hospital partners have many different pathways. without exception, the closures, the temporary closures that you are seeing have not been as a result of doctor-physician shortages. We have been able to work with Ontario Health to make sure that if an emergency department is fearing a closure, that we are able to cover those emergency department physicians. But having said that, we still have challenges with our health human resources, and that's why we have made so many investments in the short, medium, and long term. Now, one directive last August to the College of Nurses of Ontario meant that in 2022, we had the highest number of nurses registered in the province of Ontario. We will continue to do that work in the short, medium, and long term. The Learn and Stay program that was initially available only for nursing now, of course, has been expanded to paramedics and lab techs, and we've seen over 7,000 young people interested in applying and have applied for those programs. So the interest is there and the commitment from our government is there. We just need to make sure that we have sufficient people who are able to work in the province of Ontario willing to do that. And that's what we'll continue to do. Listening to the partners, the Nurse Preceptor program is just one example of how we were able, once listening to our partners, saying, what can we do to encourage and to make sure that those new nurses that are coming into the system have a educated, experienced senior nurse there right beside them one-on-one doing that training.
But what is being done now to help these communities? These are smaller communities who don't have a lot of other options like urgent care clinics to go to care. So if they need care and perhaps very urgent care, they're having to travel to other communities at some distance.
I'll give you a couple of more examples of some of the programs that have recently been put in place by our government. Dedicated offload nursing programs, which are nurses, again, respiratory techs, paramedics, who stay in the emergency department and are able to immediately assist people who come in through the paramedic system to allow those paramedics to get back into community. Fit to Sit is another example of a program that didn't exist a number of years ago and is now there. There is no doubt that we need to continue to build a bigger system of healthcare practitioners, whether it is nurses, emergency department physicians, family physicians. As you expand all of those pathways to allow people to get care in different ways, I will point to, again, a program that began in January, where now for minor ailments, you can go to your pharmacy and get help from a registered pharmacist to assist, all paid through your OHIP card. So we're expanding all of those pathways to care, and we will continue to work with those hospitals, including an announcement that was made last week to expand the number of hospitals who can tap into programs to keep those emergency departments open, because we know how critical they are to our communities.
All right. Is there any other media present at this time with questions? No? All right. That concludes our media availability. Thank you, everyone, for coming. If I could get everyone up at the podium to stay for some photos, that would be fantastic. Thank you.
Thank you.
Autant